Hi, everybody.
Hi, Penny.
Hello, everybody.
When I said good morning, good afternoon.
So had I realized that my other alma mater was going to be playing its opening NCAA game at the time that we were doing the news conference, I would have called in sick today.
No fair.
So if you start getting distracted, we'll know you're watching the game in the background.
Yeah, well, the game is here in front of me. I will just be completely honest with you. It's on my phone. So, and it's Arkansas and Colgate, and it's unless Arkansas opens a 40-point lead here in the next few minutes, I'm not going to be comfortable anytime soon. So Penny, you are giving the emergency management information today also, right?
I am.
Okay.
And I can do that all at the same time if you want, just to make it easy or
Sure.
whatever you think.
Yep.
You're the boss.
Wait, I am? When did that happen?
You were assigned that. Long time
Designated.
ago. Yes.
So an update here, Justin Smith, the Indiana transfer, has hit 2 free throws. Colgate leads Arkansas 15-14, 10:38 left in the first half. I'll just work these updates in throughout.
That would be good.
I started as a sports anchor, so this takes me back to my roots. So weird seeing Justin Smith playing for Arkansas, because since Arkansas's colors and Indiana's colors are the same, sometimes with basketball, not with football, but with basketball, I get mixed up on names with which school that I follow. And they're really the only 2 teams that I watch games for. And so seeing Justin Smith now in Arkansas really just blows my mind still.
I liked him. He was a good player.
He is. He's been great for them, and IU missed him this year.
Yeah. Is he a senior now or junior?
He's a senior, yeah.
Okay. IU women play on Monday.
Yep. Who are they opening with?
VCU, I think. Yeah, they're IU's ranked 4th in the bracket. Should be a good game. I like what they did in Texas. They named the 4 quadrants instead of north, south, east, west. They went by the city or region.
I wish they had done that here.
I know. We could have the Bloomington region. That would have been
Yeah.
pretty cool. It's the only way to get in the tournament sometimes.
Could do it like I think with Indiana, do it like the Tenderloin region and the apple butter region.
Well, that sounds good.
The fried corn region.
Chuck, what is Justin Smith's scoring average this year?
He's something like it's like 12 points a game, something like that. He maybe higher than that, maybe more like about 15, but he scored as much as like 25 and such in a game. I mean, some nights he is their guy, and he was injured for about a month at one point in the year, and they really missed him. That's when they had their losing streak. So he is absolutely key to them.
Yeah, he's a good player. I hated to see him go.
Yeah, I did too. I was glad if he transferred where he did for me.
Yeah. Did he have to sit out a year?
No, he had immediate eligibility. He graduated from Kelly, and so he was a graduate transfer.
Oh,
Colgate's opened up an 8-point lead.
Oh, no.
This news conference may not go well for me.
No swearing.
you don't have any guns or knives with you, do you?
No.
We don't want you to hurt yourself.
Well, I'll tell you, the great thing is I can now actually be a sports fan. I covered sports for many years, and the thing I learned was how to remain completely calm and quiet in the press box. So that really helps for being at home watching these things by myself, and nobody else in my house cares. So, there's no reason to yell and scream.
Did you ever follow hockey very much?
Not very much. That's the one sport I really don't know much about, because I grew up in the South and we barely know what it is.
Yeah. My cousin's an announcer for them, and I just didn't know. I think he just retired, though.
Hockey's fun to watch. It's really fun to watch in person more than it is on TV, I think.
Yeah. He was the head guy with NBC for the last few years.
Didn't they add that blurry feature to the puck so you could see it? And they kind of enhanced it.
Yeah.
In the video of it gets enhanced. So you can actually see it on TV.
Yeah, it made a big difference too, because it was hard to see otherwise.
Did you hear about the kid that got killed with a hockey puck recently?
No.
Yeah. Some kid got hit somehow got under his mask or something, killed him.
Ooh.
Yeah. I think that was high school or I'm not sure. Club, I'm not sure. Just saw it this within the last week.
All right, well, it's 1:15. We can't wait till halftime of the Colgate Arkansas game, so I guess we'll have to go ahead and get going here. So welcome everybody to our weekly discussion of everything regarding COVID-19 and the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations. We'll get to your questions in a moment, but first of all, we'll start out with opening comments, starting with Mayor John Hamilton.
Thank you very much, Chuck, and good to be with you all again. It's last Friday of winter, which is good. Just quick reports on our firefighters locally have been, I know, active in the homebound program. It's been good to see this week. Great collaboration among everybody. Thanks for all on that. We are continuing our $100 program of paycheck supplement of $100 for all of our employees who demonstrate full vaccination. There have been over 50 who filed their paperwork already, so we're glad to see that. We continue to have had 0 employee cases, positive cases this month, so I'm pleased to report that as well for March. And you probably noted that working with our downtown merchants, we have just announced the plans to close 2.5 blocks of Kirkwood to vehicular traffic starting next Thursday. There are probably some people looking outdoors saying, why don't you start it today, or tomorrow? But working with the merchants, we're doing this. Now they will be closed basically permanently, at least through June, the blocks between Indiana and Grant, and then the west half of the block between Walnut and Washington. Again, to allow the merchants to create more outdoor space for dining and safer experiences there. We're really glad to cooperate with folks and hope the weather and customers will all cooperate as well. You'll hear, I know, local numbers continue to generally look good in terms of the basic tallies as we're watching those, which is encouraging. A little flattening of some curves that we want to keep an eye on. It seems we're really in a race between vaccinations and variants and trying to make sure that we let the vaccination race win rather than any variants coming in. Of course, concern with spring break and some travel and such. So it's really important to continue to stay safe and do the things that have gotten us this far with the masking and the physical distancing and the good hygiene and staying away from each other when sick and not sharing air that you don't have to, protecting each other. We'll continue to monitor all this, I know, together. And then lastly, of course, get vaccinated when it's your turn. And it was my turn Wednesday, so I was very glad and am pleased to report a very delightful experience at the Medical Arts Center, getting my Pfizer vaccine in the evening last Wednesday, no problems. And it was a great feeling. And thanks to all who make that happen. I did get to, I'll just note, I thanked everybody who was there, but reminding them, I'm sure for them, it's now getting to be a routine of hundreds and hundreds a day. But for every one of us who comes through there, it's a really special moment and a really important time, and how much we appreciate them making that possible. So I'll take questions at the right time, and back to you, Chuck.
Okay, let's next check in on vaccines and other things with the county. And here's Penny Caudle.
Good afternoon. So I will just remind everybody that we're in the process of moving. So our main offices are closed currently, and we've managed to get all of our boxes back to our new space. And our tech services made sure that I had access today to do this press conference, and we will reopen on Tuesday, again, by appointment only, but we'll be set up and have all of our computers running and operating by then. And so thanks everybody for your patience. I know that my inbox is very, very full, and I will get to those as soon as I can. So I did want to share a few things on behalf of emergency management. Our director, Allison Moore, asked me to share some things today since she won't be here. The blood drives that the county has been scheduling at the convention center continue to go very, very well. Great success. And we thank all of the donors for donating blood, and especially Commissioner Giffens, who continues to donate blood regularly. The next drives are on April 29th and 30th, and I believe there's still appointments open. So please, you can go to the Red Cross's website, find a donation site, a blood drive, and you can sign up to donate blood and save several lives. Our Monroe County alert system, the megaphone is on our county's main page, and you can click on that and sign up for alerts. So if it's a weather emergency, if it's some other type of emergency or COVID-related important information. So we've been sharing all kinds of information from eligibility. It's not every day that you get something, but if there's a change in eligibility, they share that. If we've had to close a clinic, we've shared that information. So we're very grateful to have the use of that alert system. And lastly, Director Moore wanted me to just remind people that if they need masks, the county does still have masks and face shields available if needed, and you can find out how to get those on our webpage or by contacting the emergency management office. From the health department, we have done, as of this week, we did 36 vaccinations that were completed to our homebound program. We continue to have people sign up for that. That is done through the area agencies on aging. The city of Bloomington Fire Department and Monroe Fire Protection District both helped us get those vaccines done this week. Very, very happy. Many of those people have been waiting quite a while. They were eligible early on, and so they have been waiting very patiently, and we're very grateful. And we're very grateful for health departments. Well, we're grateful for the health department, but we're also grateful for the fire department partnership in getting those done. We will be also doing our shelters. We know that those communal living situations can be easily spread infection, and we want to make sure that those individuals are also vaccinated. So we are kind of using some of our additional doses that we have after the homebound program, partnering and putting resources together with IU Health, and we will be doing those who are homeless or have insecure housing. And then, as you know, I think the Indiana University Assembly Hall site, those appointments are up, and I know I'm going to let Kirk tell you more about that. I know he's waiting with bated breath to do that, but we will be in the convention center through March with first doses, and then we will only be doing second dose vaccines in April as we close that site down and as we gear up the Assembly Hall site. So very, very excited, and again, thankful for that partnership. Couple things coming. We've talked before about some of our partnerships with some of our representatives from the community and how we might better serve some of our more underserved communities. And next week, we should have our COVID pages on our website in Spanish. So we've had some of the people we've been working with were gracious enough to translate our COVID pages, and we will be posting those on our website next week. So they would be up sooner except for our move. As the mayor talked about, we are concerned about variants. Florida and Michigan continue to lead the way in terms of variant spread. And we want to be very, very cautious as we watch these variants. Our cases per 100,000, this week we're at 63, and those are always a week behind. So that was a little bit of an improvement. But we continue to watch those dailies, and our numbers are ticking up just a little bit. So hopefully they will go back down and we'll continue to see a downward trend. But I say that to just take the last moment to say, please be careful, be responsible, and be a force for reducing COVID-19 spread. And with that, get your vaccine when you are eligible so that we can get on the other side of this. We're almost there. Thank you.
Okay, so next check in with the Monroe County Commissioners and Julie Thomas.
Good afternoon, everyone. Thank you all for being here today, as always. Just a couple of quick notes that the Township Assistance Fund that the Board of Commissioners and County Council worked on together is still active and still available for Township residents. If you are struggling to pay for things, the necessities like rent and utilities, please contact your Township trustee as soon as possible. Every county resident lives in a township. If you need help finding the contact information, go to co.monroe.in.us and check in on the emergency management page. In addition, we continue to provide CARES money directly to our community for businesses, social services, and for taxing units. And we continue to accept those applications through the end of April. So if you have a COVID-related expense that has not been covered by another program, another grant or loan, and it's a non-payroll expense, please submit it with the paperwork through our website, co.monroe.in.us. And we are now cycling through these approvals monthly. This week we approved over $86,000. Our grand total right now is $816,541, and we're trying to keep our economy strong and keep our social service safety net there for us once this pandemic is finally over, or at least minimized. So another thank you again from all of us on the Board of Commissioners to everyone who continues to wear your face covering. Even after you've been vaccinated, please do so, keeping the 6-foot distance and just generally ensuring that our community is safe. And when it's your turn, please get vaccinated. Thanks. We'll take questions.
Okay, so next check in with IU Health and Brian Shockney.
Good afternoon, everyone. Thank you for attending today. We continue to see a steady number of COVID-19 patients in our hospitals in the South Central region and in Monroe County as well. We've leveled off, but it's all good news as of where we're headed. As of yesterday, our ICUs at IU Health were 65% occupied. Here in the region, our ICUs were 44% occupied, which is much improved from actually a week ago. But we still have patients coming in who are very ill, and we're still fighting COVID. So as everyone is saying, and we just have to say and remind people, especially as we can get this good weather, don't let up. Continue to follow those safety precautions and wearing your mask and social distancing in public. So this week, we administered our 50,000th dose vaccine. In addition to our 50,000th patient this week, we had a very special visitor as Mayor Hamilton received his lucky shot on St. Patrick's Day. Our Bloomington clinic has administered 40,000 of the 42,260 vaccines we received to date. And so that puts us at that continued over 90%, so 93% utilization percentage this week. So overall, we have given 52,342 vaccines. Our recent focus in our region around vaccines is outreach, much in the way the city and health department have with homebound patients, as Administrator Cottle shared earlier. Our outreach efforts are working to answer questions and better assist those in communities who have barriers to access to vaccines and other important healthcare needs that we've connected with, either through their primary care or through other ways we've been able to discover that. Examples of the outreach include partnering with the health department cohorts to bring vaccinations to homeless shelters so these individuals can get their vaccines more easily. And we have several dates over the next few weeks, as Administrator Cottle shared, regarding visiting shelters, locations, our communities, and provide vaccines. IU Health announced yesterday that we have started offering free rides with the support of a recent grant we were awarded for COVID-19 vaccine sites in the state. So that's in order to eliminate the transportation barriers that some of our Hoosiers have in getting their vaccines. Ride services are available to anyone in Indiana. The appointment does not need to be at an IU Health vaccine site. So if you need transportation to your vaccine appointment, call 1-888-IU-HEALTH, again, 1-888-IU-HEALTH, and choose option 9. Rides are provided at no cost. Callers will be asked if they have insurance in case their insurance provider already covers the cost of transportation. In addition to removing physical barriers to accessing vaccines, we've also focused on increasing knowledge and awareness of the vaccine with our most vulnerable populations to help ensure equity in vaccination. We've had our physicians on the local radio program Bring It On in recent weeks to share what they know about the vaccine and to talk through questions the community may be hearing. In the chat, we share the link to the radio show so you can listen to those radio shows. Very good physicians who are providing great information on that Bring It On show. Sean Gerber, also our regional chaplain, has also been reaching out to places of worship. And so we're working with our places of worship to make available information to congregations as well. And then I want to recognize Dave Askins of the B Square Beacon, who published an article this week that breaks down the disparities in COVID-19 vaccine numbers. Dave's article highlights that we are making good progress with those that are eligible under the state criteria for vaccination. So thank you, Dave, for your great reporting and timely information to our communities, but also shared in his article that we have a ways to go, and we're all working in that direction. We take some comfort in the research and the work that's being done. We still have to reach those who are most vulnerable in our populations. Now, as the younger age cohorts are getting opened up, and we know that that will happen here soon, as we see the supply of vaccine will soon, hopefully in May, outpace the demand as we get more and more provided, we need to be sure that if you have gotten your vaccine, that you spread the word that it was a good thing, and that you would encourage everyone in these younger age generations to get their vaccine and the reason why you got your shot. And that will make a difference, hearing it from you as leaders, as friends, as relatives, and family members. So please share the word, and thank you for your attention, and we will take questions.
Okay, let's check in at IU and Kirk White.
Hey, good afternoon, everybody. As I usually do, I start out with numbers, and this last week, our numbers were holding steady at about a 0.2 prevalence rate. However, this week, we're still compiling the numbers, but we're seeing a slight uptick. So it looks like, particularly in our student population, we've seen some increases in the prevalence rate that we've not seen this kind of jump yet this semester. So we're keeping a close eye on this. And again, as I've mentioned, our intensive testing, and last week we conducted 22,000 mitigation tests. So this week we're continuing that trend. We've done, I think, 14,000 or so as of the report I saw this week. And so what we're able to do is when we see these infections, we use our contact tracers and we find out where they are, who their close contacts are, and we get them into quarantine and isolation. And this week, our occupancy at quarantine and isolation is going up to get those students isolated and stop the spread. So our systems are working. That's the good news. The bad news is that we're starting to see an uptick, and I'm a little concerned about that, even though IU did not have spring break. Others in the school corporation, there has been some travel going on. Some people took a break. And if they have been exposed in places that don't have the same levels of protections going on that Indiana does, we may see some spread back here. So we're going to continue to keep an eye on that. So that's being completely transparent. That's the latest information I have. And so I just want you to know that we are watching that this week. There are 2 of our fraternity and sorority houses that are now in quarantine due to these new cases that have come to our attention this week. Let's see. Yes, Penny mentioned the new IU and county joint vaccine site that is set to open on March the 29th. And I can report this morning that all of the appointments for the 29th are filled. So we're now live on the One Shot or Our Shot website where you can make your appointment. And I'm sure the other couple of days we're going to be open that week will be very popular. Fill those up for us, please, because our strategy is to get them full so we can demonstrate to the state that we can take more vaccine and open up more appointment sites. So log on and pick the site, whichever is closest for you, of course, but I just want you to know that the Joint IU County site is available, and I'll give you a link to some more information about that here in just a sec. Let's see, that concludes my report for the week. Some little cautious news. We do need to remember that the virus is still here. It's still active. We need to maintain the protocols that we've got in place, the distancing and masking. It works. As Dr. Fauci said this week, it is not theater. It's scientific evidence. And that's the way we look at it at IU, and we'll continue our community efforts along those lines. Let's go at it. Thank you.
All right, thanks, Kirk. We'll get into the questions. Question from the HT and Jenny Tilley, this one going to Penny. Has the local health department already started working with schools on implementation of the new 3-foot social distancing guideline for schools that has been announced today?
Well, we have been working obviously with the schools and the Department of Health and Department of Education all year and for more than a year. But certainly we have been having these conversations about the 3-foot distancing for several weeks now. That has been kind of part of what schools could look at and do. So the answer to your question, Jenny, is yes. And we will continue to work with them, and schools will decide what works best for them and where they can do those things. Certainly how they do close contacts has changed more recently based on the distancing in the schools and things like that. So we will continue to work with them very closely on that.
Question from Dave Askins, the V-Square Beacon, for Penny and Brian Shockney. Do we even care anymore about the 70% vaccination figure for the total population, or have we started focusing more on the 40+ population? And if so, why the shift in focus? Penny, you want to start there?
Are you talking in terms of age group?
I think it's if there's a shift in focus between getting 70% vaccinated of the total population, rather now focusing more on just 40+.
40+%. I'm sorry.
40+ in age.
Yes. So when we have 40-year-olds and over, when we've got those folks through and vaccinated at a high level, we will have covered really those that accounted for 98% of our deaths in our state. So there is very much a concern to continue to get people who are older, but 40 and older. And then I think we'll really start seeing the age drop in terms of eligibility. But we are concerned about getting everybody vaccinated, Dave. That's our goal, is to get enough vaccine and keep enough interest so that everybody is getting vaccinated.
Brian, do you want to add to that?
Yeah, I think it's both and. We're, as Penny said several times on our calls, we're looking at lots of numbers, but herd immunity is what we're going for. But it's kind of it's the leading, kind of like leading metrics and indicators leading to the outcome. And so the leading metrics and indicators are getting those age groups in a shot in every arm, and then the outcome is we get 70% plus of our population vaccinated, and we can begin to think about lessening some of those restrictions. And so it's as Penny said, it's shots in every arm. So it's all of those things. It's not one or the other. So thank you for the question. We do we still want to get to that herd immunity.
So again, for you, Brian and Penny, we'll start with you, Brian, on this one. The number of final doses administered has sort of stabilized at a rolling daily average of around 325 final doses per day for the last 4 weeks. I was thinking that number might edge upward given the extra doses that IU Health was supposed to be allocated and given the additional doses for homebound outreach. And his question is, are we continuing to receive as much vaccine as we're supposed to?
Yes, and that's a product of we're receiving the same amount of vaccine. J&J's doses were used by the state mostly for the mass vaccinations, and so we did not receive a lot of the J&J, and right now we're not receiving that until they get another large shipment of J&J into the state. Expectation is that that will ramp up here in the next few weeks, and we'll be getting those additional doses. So what you're seeing is our appointments are filling, but we're getting the same amount of vaccine that we've been getting, and the J&J doses were a small number that were given overall because the state wanted to make sure we were doing mass vaccination across the state, and that's where most of those J&J doses were distributed.
Yeah, Penny.
Yeah, I don't have much to add to that, just to even say that with the homebound program, that started out really to be focused on those extra doses. So, the intent of you wouldn't have to have your standby list would be that homebound list. And because we kind of got a late start with that, that's what we've taken to get those individuals done. And then again, to do those individuals that are at greatest risk, because we didn't get a lot of vaccine, and we'll continue to do those outreaches as more vaccine comes. But Mr. Shockney is right, exactly spot on.
Another question from Dave at the B Square Beacon. This is for Kirk and Penny. My back of the napkin says if on March 29th, Assembly Hall started jabbing 2,000 people a day, which would eventually translate into 1,000 final doses a day, we'd have 70% of the county's population vaccinated by mid-June. Question, do you have an idea yet about how much vaccine will be made available for the Assembly Hall site? Penny, you want to start there?
Certainly. I love your math, Dave. So we would love we would love to be able to do just what you described, and we will strive to do just that. We do not know exactly how much vaccine we'll get, usually more than a week or a couple weeks ahead. Again, the state, they let us know when they know. And so there's not a lot of advance notice on how much is coming. But we will continue, and we do continue to tell them what we believe that we can do at that site, and we'll take all the vaccine they will send us.
Yeah, and I just add that, we're going to be ready to do that number if the supply came that way. And in fact, we're looking forward to including not only our own staff, but volunteer staff that the county has already recruited, and from the Monroe County Medical Reserve Corps, we can surge this to pretty good size. And in addition to that, we've been talking to the state about how we could do one of these mass vaccine type sites for a weekend or brief period, where they would send even additional assets to us, perhaps from the National Guard. And those meetings have already started to in the planning phase. So if there is supply, we'll be ready to go in that direction and fulfill that mission. But it's all about supply. We're hoping that as more J&J and others come online, that we'll be able to do that. And by the way, the governor is due to have a news conference next Tuesday afternoon to describe a little more about where the state's headed, and maybe we'll get some better indication next week when he makes those announcements.
As we always say, IU, of course, has to wait on the state to make these calls on vaccine, as everybody does, but we get asked that question all the time. Waiting here for more questions. We have plenty of time, and here's another one from Dave. So for Penny. The state's daily data set for Monroe County shows single-dose shots administered in the county started around March 5th at an average of 50 shots a day, a couple of days as high as 80 or 90. The back of your napkin is getting full at this point. It sounds like that's way more than the shots that are being distributed in the homebound program. From that, can we conclude that there's Monroe County residents who are getting vaccinated in other geographic locations?
Yes, you can. And some of the pharmacies, I believe, may have had some Johnson & Johnson as well. But remember that the state has been doing these mass vaccination sites, and they did over 16,000 at the Indiana Motor Speedway. So there's been a lot of vaccine that has went out. And I know personally many people that went to Indianapolis Speedway to get their vaccination of the J&J. So yes, I think that you can assume that you are kind of on target there. And the only other thing that I would add on while we're kind of waiting is that we are beginning to get a lot of requests for extremely large gatherings. And I just wanted to make note that we're not there yet. We hope that we can get there, but we need to really bring our numbers down and get people vaccinated before we can really start to address these large gatherings. And it's just difficult right now to say where we're going to be in 3 weeks, let alone where we're going to be in 3 months. So we have the tools. We use them well. Then I think that we can be looking at more normal things in our near future, but we're just not there yet.
Okay, and I'll vamp here for a moment, waiting for other questions if you have them. I will update you that I had to turn the game off because Arkansas was down 13. They closed the half on a 17-0 run and are now leading at the half, I think by 3 at this point. So I was getting too distracted. I wasn't paying enough attention to what you all were saying here. So just full disclosure here. Happy to take other questions. We still have quite a few minutes left here. And I'm going to do a moment ago, Kirk, is give a plug for further information for those who aren't within the IU system. If you want further information just in general on the vaccines, we do our Ask Aaron segments every week, Wednesday at for the IU community. Many of you probably have watched those. Those are archived cast.iu.edu. And in recent weeks, they have really focused on vaccines and questions. They really get down to particulars with that. If you have questions, I would highly recommend those with Dr. Aaron Carroll. He is a professor of pediatrics at the IU School of Medicine, but the director of mitigation and surveillance for the COVID-19 pandemic at Indiana University. So let's see, here's another question from Dave. There's a 3rd through 8th grade basketball tournament being hosted at the end of March here in Monroe County. The games are going to be played in Spencer because of tighter restrictions on attendance in Monroe County. Which of our restrictions would apply to a basketball game? That'd be for Penny, I would.
Well, it would, if it is just a local tournament, it would probably fall under an event and need to have an exemption request unless it was going to be limited to that 50 person. So if it is the end of March, they should have already submitted an exemption request. Now, if they're playing all the games in Spencer, they wouldn't need that request to come to us. It would be Spencer, it would be Owen County that they would have to make sure that they were in line with those 4. I can understand that if a tournament is kind of sponsored by somebody out of Monroe County, but they're being played in Owen County, that people very well will be staying here. And so we would just encourage everybody, just like we always do, to maintain our distancing, our mask wearing, follow the county regulations. Our compliance officers do continue to be out and follow up on businesses. We continue to get information through our complaint system online, and we do follow up on those.
Sure.
Okay.
Chuck?
Yeah, Mayor.
Yeah, I might just note, and this is This is a little bit of an example of how the scattershot regulations can cause difficulty, because this is a tournament that was planned and has been, I think, in the past at Twin Lakes Recreation Center, and Parks talked with our local county health folks and kind of reached the agreement that that wasn't safe to do and wasn't in compliance with our local regulations or an exemption for lots and lots of kids and their families indoors. But they are basically staying in Monroe County hotel rooms. Probably these are folks visiting from different states even, I think. But then the next county over, the rules may be different enough that the gyms are, yeah, let's have the games here. My guess is they won't be any safer there. In fact, I might wonder if they're as safe as they would have been here. But because these are county by county, you can get this kind of outcome, which is of concern, because the families and kids will probably be mostly staying in Monroe County hotel rooms while playing over there. So it's just a reminder that it's tricky. I continue to appreciate our county, our health leadership, and all of us trying to do what we can on these kinds of episodes, much like the NCAA tournament, different rules in Monroe County than others for the March Madness. But it is a reminder that we are not an island, as we've said before, and this kind of stuff can still affect us quite a bit. So we'll have to encourage compliance and be careful and remind people about the gathering limits and mask mandates and all those things that are still in effect here.
And Dave does confirm the teams have booked rooms in Monroe County and says the Convention and Visitors Bureau is happy about that. So got time for another question or two. If anyone has one, we'll hang on here just a second if you do. Otherwise, would encourage everybody to root very hard for the team in Cardinal and white.
You're shameless this week, Chuck. You're shameless.
Well,
Are you going to expect all of us to be pulling for him? And be careful.
Well, we don't, IU's not in the tournament. You have to adopt a team. I'm just saying.
Root for the IU women on Monday. Root for the IU women on Monday.
Yeah, and the IU women play Mondays. So there's your women's tournament. You have a dog in the fight. So, and Kirk just has put up the link for the Ask Aaron seminars on Wednesday. And again, those are archived at broadcast.iu.edu, and you can see those there. Well, we will wrap it up there, and we will see you again next Friday and talk about things related to COVID-19 then. Thanks, everybody.
Thanks, Chuck. Thank you, everybody.